So now, Terry Williams, we're going to bring you up, and you are next up to bat. Thank you very much.
Perfect.
Thank you so much.
Hopefully everybody can hear me talk. I don't like standing behind lecterns. I like to walk around.
Good.
Provided I don't fall off of this two-step little stage here. That's me. You can call me TJ. Terry's my official name, but everybody that knows me, that truly knows me, calls me TJ. So if you call me, say, hey TJ, otherwise I won't answer the phone, or probably return your phone call. There's several places in the country that are doing research specifically with magnetic therapy and cancer. Okay, they're using a little different. They're not just, there's anecdotal stories out there of somebody got sick, treated with this, got better. Okay, that's fine. There's anecdotal stories for everything. But what these guys are doing is they're actually using, and that's the final paper, or final paragraph, that's a conclusion paragraph that Tracy Hampton wrote. This is a JAMA article that I don't even know if it's in publication yet. It may just be electronic right now because it's a 2011. I just got this email to me 3 days before I put this presentation together for this. Basically, what they've done is they're using chemotherapy and putting very, very low doses that would have absolutely no effect on anything, and allowing the electroporation that happens with putting PEMF on the area to uptake that chemotherapeutic agent and kill the cancer. And unfortunately, we don't have QuickTime and the decompressor needed to see the picture, because what I actually took is I took the picture, the before, during, and after treatment of this person whose skin cancer they used and cured in, I believe, 6 weeks. It was, by the looks of the pictures, maybe the size of a nickel. It was open, red, oozing, nasty looking thing. At just a couple of weeks, it was all crusted over and black, and then the very last picture, it's completely gone. And that's what this talks about, is they're using this to apply these chemotherapeutics to cancers. That's huge, very huge. All right, this is just a synopsis of the slides that you were just looking at. Just different things that PEMF have been shown to do. I don't really care about most of these. What I care about is this one and this one the most, because that's what people that I treat, that's what I'm taking care of. I'm taking care of people that need to heal or they want to feel better, and I'm taking care of athletes who need to make more energy so they can go faster in their race or whatever. Mostly I dealt with track athletes, track and football. I was the team chiropractor for the University of Arkansas, and I traveled exclusively with the track team. That's why I got into the track, and I like track. You got about 500 things going on. It's good for my case of ADD. The electron transport in mitochondria, that's important as well, as is the increasing cellular oxygen levels. Another thing that I did when I put this together is I've been slowly but surely making a list of questions that everyone has when they first talk to me on the phone. Jim has a lot of people call me if they're interested in a device and talk to me on the phone. And I just started compiling the questions that they ask. And so that's how I come up with a lot of these slides. And a lot of people ask about the cellular oxygen level, and we already had the question, somebody asked it earlier, about the diminishing Rouleau effect. Everybody familiar with the Rouleau effect? Is anyone not familiar with it? So I can tell you what it is.
We know what it is.
Everybody knows? Okay. So there's actually a video out there, and I couldn't find the link. I was in a hurry. There's a video out there on a website that actually has it under microscope. You can see the red blood cells going through, all stacked all together, and then they apply the PEMF therapy to it, and almost instantly they all disperse. So you can see the Rouleau effect get eliminated. It's rather interesting. I wish I'd found the website. I don't save a lot of stuff because my computer would be just full if I did. Benefits of PEMF. When people ask what can it do for me, this is the list I tell them. Big one is pain, and we're going to talk a little bit about pain and pain modulation today. Reducing inflammation, increasing range of motion. Accelerating nerve regeneration, that's kind of cool. I got the link on here that you can write down for the study that NASA actually did that shows that they can regrow nerve. They regrew it in a petri dish, for crying out loud. If you can regrow it in a petri dish, I promise you, your body knows how to regrow it with this stuff too. The reduced muscle loss after surgery, this is very important. I actually utilize this, and we'll talk more in a bit. I've got a case that we'll talk about. I actually had a kid that had a rotator cuff injury, had a slap lesion due to a wreck, and he didn't have any muscle mass loss after the surgical repair. That's all we treated him with. It's pretty interesting and very, very exciting, to say the least, considering that in the fall, this kid will be playing on Sundays, provided we get this collective bargaining agreement taken care of. So that's pretty much the benefits of PEMF. Here's the NASA study conclusion. I found it very interesting. Where's the sentence here? Right here. One may use this electrical potentiation for a number of purposes, including developing tissues for transplantation, kind of important. Repairing traumatized tissues, which anyone that's treating anyone that has any type of musculoskeletal injury, that's what you're doing. And moderating some neurodegenerative diseases and perhaps controlling the degeneration of tissue as might be affected in a bioelectric stasis field. Another case that I will talk about just briefly that is not in my slides, I started taking care of a lady that had MS, okay? And the plaques that she had were not in the brain at all. They were in her T-spine, right at T4. And so she presented, with it being in that location, she presented with all kinds of weird stuff. She went on with these weird symptoms for quite a while before the doctors finally figured out what she had. She was pretty young when she got diagnosed. I started treating her, she was 42 when I started treating her, and she had the stuff for 10 years. She'd been diagnosed for 10 years. And one of the craziest things that she had is she had a spastic, I can't remember, leg, we'll call leg. And so she had to walk everywhere she went like this. And her balance was terrible. If you asked her to stand on her good leg, she was going over. She couldn't compensate for this dead weight mass that she had out here. So I started treating her with the magnetic therapy. I did a few other things chiropractically. I'm a chiropractor by trade. And so I was doing a lot of stimulation of occipital fibers as well. And what we figured out is that if I laid her on the body mat and was treating her, and I pushed on one of her occipital fibers, that basically gave her leverage, and she could do this. The first time she did it, she cried. I cried. My office lady cried. Everybody cried in the whole place because she hadn't straightened her, or hadn't bent her leg in over 10 years. And so I continued treating her, same way. Occipital fibers changed. I had to go left to right and so on and so forth. But it was very interesting because when she started getting better and feeling better, she would tell me, oh, last night I was walking around the house and for 45 minutes I could bend my leg and I walked normal. And so all I did was climb the stairs. Climbing the stairs. All she wanted to do was climb the stairs in her house. Pretty impressive. When I left that area, she was not very happy to see me go. It was very sad, but that's just one case of MS. And I thoroughly believe that if I had stayed around and been around to treat her for 2, 3, 4 years in a row, that with what we're doing with PRP injections along with the PEMF, I think we could have got her to where she was walking normal on a daily, regular basis. So what happens when soft tissue is damaged? Excuse me. Just getting over bronchitis. So the cells separate, and Dr. Gordon's already talked about this a little bit. Basically, it's not like we're opening the front door of a cell and everything can come out. It's more like opening a window. So just some of the things come out. You're not going to lose the nucleus out of a cell when it's damaged. But the separation causes the stuff inside the cell to leak out. basically that cellular debris that gets out in the outside of the cell is what attracts all the things that just lead you right into inflammation, swelling, pain, and so on and so forth. And so how does it do this? How does PEMF work? Basically, it just stabilizes the cell. It goes around and closes the windows. That's the example I give to my patients. They don't understand phospholipid bilayer and gap junctions that happen and all that. They don't know any terminology. And so I don't talk to them like that. I tell them, look, your house is basically got the front door open, or the windows all open, and so this is just going around and closing the windows so you don't lose anything out of the house. And this pulsing action, and most of you have had the treatment in here. We treated a lot of you up back there. You felt the muscles twitch. That little twitching sensation that you're getting is just contracting the muscle and helping pump the fluids along, lymph along, just gets things out of there. Once you start moving lymph, it just keeps going. It just keeps rotating. People in their relationship with pain. It just cracks me up how many people I treat in my office that say they can't participate in whatever recreational activity they can't do, they like to do. I have one guy that come in, severe shoulder pain, upper back and neck pain, and he wasn't there because he couldn't go to work. He was there because he couldn't go play basketball because he couldn't do this. I said, well, how do you do your job? He said, oh, I just don't do that. Or I call in. He calls in sick because he can't do this, which is related to part of his job. But he comes to see me because he can't do this because basketball season is just picking up for his intramural basketball league. He could care less about work. He cares about having fun. And so when they hurt too bad, they want it fixed right now. All right, action potentials. Everybody in here understand action potentials. I put it in here because I had no idea what type of audience I was exactly going to be talking to. I assume everybody's good on what an action potential is. And then that's just an explanation. The same explanation. Okay, so basically you just got the pain traveling along the axons. How it actually modulates the pain and what happened is hopefully this picture. This is the picture that I use to teach. I teach physiology as well, or I did. And I use this picture a lot because the picture says a lot more when explaining this to my students. Because they ask what I do and I tell them, and I teach them about magnetic therapy. I taught at massage school, so therapists, they want these devices to help them along, make their job easier. So basically, this is your picture of your average action potential. What happens is when you have injured tissue, this threshold level, or this baseline level, just raises a little bit and gets a little closer to threshold. So it takes less stimulus to reach this threshold, which once we hit threshold, it's all or none and we take off. Where PEMF comes in and works its magic is on the back side of this, okay? It takes this state right here, basically right in here, there's an absolute and relative refractory period right here. Absolute is like right along in here, it stops right about here, and no other impulse can take place. But during this relative refractory period, if the stimulus is strong enough, you can actually fire that impulse again. What magnetic therapy, pulse-magnetic therapy does is it hyperpolarizes. So it creates a larger distance between the threshold that we have to get back up to and where we are as far as millivolts are concerned on the graph. So we're hanging out down here in this hyperpolarized state. So the light touch on the injury that used to send you through the roof doesn't send you through the roof anymore. It's not as painful. And once you're out of pain, then your body can heal. And he had a little slide in there talking about, I forget exactly what it said. Basically, when you take the pain away, you relieve the nervous system to go on and do other things. Same principle is going on here. And now I've got clinical studies. How much time do I have left?
Another 20 minutes will be fine.
Okay, all right, I can talk for 20 minutes. So, case studies. Anybody can feel free to ask questions. This is interactive. I don't just stand up here and go. These are some of the case studies that we're going to have. We actually have a nice little treat on Monday. This little 20-something Olympic athlete lives here and is going to come and talk to you about how the therapy helped save her Olympic career. Okay, so I actually invited her. Figured she would want to talk about it. You actually saw a picture of her earlier on the screen. That's why I wrote 20-something, because she's not really 20-something anymore, but she was when I treated her. So we won't get into that. So we got a 46-year-old female with neck pain. Now these first three are not my patients. These are actually another person's patient that has a thermography unit. And so I've got, if they come up, I've got before and after pictures, very similar to the horse pictures that we had earlier. And then the rest of these are my patients. And actually, that one is me. So let's start with the 46-year-old female reflexologist. Typically, it doesn't matter what their profession is, but with this one, it does. It does a little bit with neck pain. So basically, all she's doing all day is sitting in this position. Okay? So she's got neck pain. Head forward posture, so she's complaining of neck tightness. She got treated for, I believe, 5 minutes. Is that what they said, Jim? 5 minutes? Both of the females are 5 minutes. 5 minutes of treatment, and her pain scale went from a 7 to a 1 with 5 minutes of treatment. We had a neck that was all bright red. Now if you can imagine right here, a neck that is blue and green. That's what it was after 5 minutes of treatment. How did that work? Oh, excellent. Look at here. We got hard copy pictures.
I'll get him.
He's right here.
Okay.
We got hard copy pictures. So, see? All red and then nice and yet green and yellow. And I'll pass them around. Y'all can look at them.
That's good.
So, that was just 5 minutes of treatment. Now here was another interesting one. I wasn't going to leave all this information in, but I did at the last minute because it kind of paints a picture of what happened with this young boy. 14-year-old autistic male, and from what I understand, when he was 2 years old, he got some nasty infection. He was on meds for a long time, okay? And so he was on these antibiotics for 5 months. And then at the very end, he was on some sort of shot. And I don't know, they rattled off the name of the medication. No clue. For 5 days. As soon as they finished that last day of shots, the kid couldn't walk up or down stairs, clap his hands, couldn't point, and he reversed by his doctor's diagnosis, I guess, to a 6-month-old, like that. Okay, so at the time of the images, which we're going to need those hard copies if you got them, because I'm sure they don't pop up. Do you not have the hard copy of that one? In the room. Oh, okay, perfect. We'll bring them tomorrow or the next time I talk and show you. The pictures, if you can imagine this kid, they're pictures of I think they're of his chest, they may be of his back, but the kid is just bright red. He's red everywhere. And he'd just been treated for MRSA, and what they were doing and this is what they were doing, they were using the butterfly loop, treating him everywhere. They were putting it on his shoulder, on his abdomen. He was actually laying down on his abdomen. He was laying on the butterfly, I believe on his back as well. And then they put it on like a crown around the top of his head and treated him. Now they treated him for about 30 minutes, and this was all broken up into all these different places. And the results are pretty astounding. He goes from bright red to light yellow and blue and green as well, which would be so pretty right there. However, that's okay. It doesn't surprise me. I'm a Macintosh person. This thing, whenever I don't have a Mac to work on, who knows? All right, and then we had a 45-year-old female with back pain. And this was rather interesting too. In talking to the doc that had the thermography unit, I didn't understand this, but she said it's very common that it's a picture of her upper back, and she says that there's a pattern that comes up on T1 that is indicative of people that have metabolic inflammatory issues. Never heard of such, have no idea. But sure enough, it's actually about T2, T3, somewhere in there. She got a bright red spot. And so they treated it, and it basically lessened and became much less intense on their thermography scan. And there would be a nice, pretty picture right there, but we're left with QuickTime. PEMF and ADD, ADHD. I've actually treated quite a few people with this, and almost everyone, after I figured it out with him, has the same outcome. Almost everyone. It doesn't matter where we treat them. It doesn't matter how long we treat them. The outcome is almost identical. So, my 19-year-old cousin is a track runner. Believe me. Imagine that. He lived with me for 4 weeks in 2009 during the summer. He was actually at where I was working at. I had an indoor training facility, and he was training to better himself. And what he had been taking is Concerta for his ADD. If I remember right, he was taking 20, whatever the units are, milligrams, 20 in the morning and 5 in the mid-afternoon, evening. Could have been 10 and 5. Something like that is what he was taking. And he just absolutely hated how the stuff made him feel. He always got real jittery. He would sweat for no reason whatsoever. His face would get all flushed. He had some pretty weird reactions. I mean, I don't know anybody else that was, on Concerta that I was around all the time where I actually saw these things take place. But when he wasn't on his medication, you couldn't stand to be in the room with him. He was all over. I mean, if he were in here without his meds, he would have already sat in every single seat and probably moved everyone and tried to talk to everyone 5 or 6 times. It's ridiculous how ADD he really is. It's insane. And so, there's several things out there. A lot of different people do a lot of different things with ADD. Not that any one thing is better than anything else, but some things that have worked in the past for some people is sitting on a vestibular disc. And so with that, I was like, well, basically all you're doing sitting on a disc like that is increasing neural drive. So I thought, let's just put the big loop on him, on the chair, have him sit on it, and we'll just see if we can increase neural drive. He turned the machine up until he could barely feel the tapping. As some of you who I've treated, I rarely, if ever, treat beyond just barely feeling that sensation of tapping. I don't turn it up very much. That's just how I treat people. I have phenomenal results with it. Other people treat with it more intense. Really makes no difference. But he was just barely feeling the tapping. My machine has a 3-minute timer, and then it shuts off and I have to reset it, push the button again. I pushed the button to start it the second time, and before it clicked off, he was sleeping in my chair. Not just sleeping, snoring loudly, like he hadn't slept in days. And he stayed asleep. This is what I didn't put on here. He stayed asleep for 4 hours. One treatment. Out cold. 4 hours. When he woke up, it was, I don't know, I got home from work that day at about 2. It was a Friday. I got home from work about 2. He slept until probably 6:30, 7 o'clock, because I treated him as soon as I got home. And he got up, we had dinner, goofed around, watched a movie or whatever, and went to bed around 10 o'clock. And he went to bed and slept all night, just like he hadn't taken a 4-hour nap in the middle of the day. Okay? So, we treated him every day for 7 days. I like to treat people as many times as possible, in as many days in a row as possible. Personal preference. If I can get somebody in and treat them Monday, Tuesday, Wednesday, Thursday, Friday, I do it. And then I see how they react over the weekend. I get them back in the office on Monday morning. And that determines how I treat them from there on. If they have the results that I'm looking for, we back it off. We treat them every other day for a week or two. If they're not having the results I'm looking for, we treat them every day that week. That's just how I treat personally. So we treat him every day for 7 days, and then the next week we treat him every other day for a week. And then the whole rest of the time, he was basically twice a week. Now sometimes those twice a weeks would be Monday, Wednesday. We wouldn't do anything until we got all the way back around to Thursday of the following week. And then he might treat Thursday, Saturday, or Thursday, Friday. It was just kind of in general that it was twice a week. It was never really a set time. Unbeknownst to myself, he quit taking his medication after his 5th treatment. Okay? And I didn't know. I had no idea. And once he stopped his treatment, at the very beginning of August, he stayed with me from July 4th until the first week of August. When he stopped treating with the PEMF at the beginning of August, he didn't take his meds again until Thanksgiving Day. The only reason he took them on Thanksgiving Day is because he was nervous about the fact that he knew he had ADD and all the family was going to be around and he didn't want to be out of control. He even made that comment. He's like, I really didn't need it, but I took it just because I was nervous because I didn't want anybody to get upset with me. He's very emotional that way. It's kind of odd, but that's him. That's my cousin. So, what did I learn from all this? What I've learned is it doesn't matter if someone has ADD, where or how you treat them. So being a runner, he gets shin splints. I treat his shin splints. He goes to sleep. He fell down, hurt his arm. I treated his arm. He fell asleep. It made no difference where I treated him on his entire body. The effect was exactly the same. He fell asleep. So, that's one of the things I've learned. I'll stop there and let the next person come on up because I believe the next one. PRP. Oh yeah, PRPs. So what's going on with PRPs? I'm actually getting involved right now. One of my really good friends is on the board of directors for the International Cellular Medicine Society. Okay, so just to give you, how many people are familiar with PRP injections, platelet-rich plasma? Nobody else is really familiar? Anybody even heard of it? Heard of it, just not familiar. Okay, perfect. So, what's happening right now with PRP is the FDA is trying to say PRP is a drug, and they want to control it. They want to regulate it. They want to say who can have it, when they can have it, and for what condition they can have it for. Okay? The argument on the other side of the fence is, well, I'm drawing blood from you, I'm spinning your blood down, and I'm sticking it back in you. How is that a drug? So where the problem lies is there's a miscommunication. Okay? There's 2 different types of PRP. We can go into your iliac crest, wherever, take mesenchymal marrow stem cells, and we can grow those in a petri dish. Okay? Then we can come back about 10 days later and put them back into solution and stick them back into you and regrow things. Okay? That's what they are trying to regulate and say is a drug. 4% of your blood is free-flowing stem cells. What we are doing is we are drawing your blood, spinning that down, concentrating it. We're using a specific type of kit so we know about how much of the good stuff we're taking, we're sticking that back in. That's not a drug. So what we've done is some buddies of mine have set up this International Cellular Medicine Society. And what they've done is they have set specific guidelines. There's 35 facilities throughout the United States that actually operate under the International Cellular Medicine Society's guidelines. Okay? And what they're doing with that is every single person that gets injected is followed. They're going to be followed for as long as they live if we can keep in contact with them, but we're trying to do a minimum of 5 years, hoping for 20. And for people like me who got injected when they were 30 years old, 32 years old, they're hoping to follow us for 40, 50 years. Okay? And So what we're doing is we're finding out a few things. There was a slide earlier that Dr. Gordon had put up that said something about a systemic effect of stem cells. It's true. We've played around with it on some guinea pigs, and we've seen very similar results. If somebody has inflammation, we don't have to put the stem cells right where they, or the PRP injection right where the problem is. We can just give it systemically, and there's a decrease in inflammation. Healing takes place. Now, when you put the PRP there, what we're finding is that the platelets don't really move. They actually stay there, act as like a job foreman, get everything going and rebuild the structure. Personally, these are the conditions that I have either watched on MRI or treated myself with PRP and magnetic therapy. This is where it gets really exciting, is the introduction of magnetic therapy. We have regrown an ACL that hasn't been present in a knee in 20 years. We have regrown hamstrings, regrew a scapholunate ligament. I'll talk more about that tomorrow because that was mine. We've regrown the bone in a 5th digit. We took a plate out of a skull and regrew the skull, the skin, the hair, and everything, and it matched the balding pattern on the other side. We've regrown hair. We actually took one guy who had a big, I don't know, whatever the male balding pattern is right here, and we drew blood and we stuck about, I don't know, 500 holes. He regrew hair right where we stuck it. Pretty powerful. Now, when we introduce PEMF, what we're finding is that if someone has something going on and they don't necessarily have to get injected right now, if it can wait a week or wait 2 weeks, and we treat them with PEMF, when we draw their blood and spin it down, the concentration of PRP is increased. The platelet concentration in the growth factors is just a smidge higher than what we have in someone who isn't treated. Okay? And so what we're seeing is people that get magnetic therapy, PEMF prior to an injection, and then a month after, heal. It varies. Every person varies. But we're seeing 30-40% faster healing times.